When you're playing volleyball and you go for an approach or a front or back row attack, and after you land, one of your knees hurts, it's very possible that you have something called jumper's knee. Jumper's knee or patellar tendinopathy is a syndrome that typically happens when you put a lot of strain on one leg. So let's say you're going up for an approach, a jump serve, a back row attack, and you land on one knee and you have excruciating pain. It's very possible you have something called jumper's knee. So, patellar tendinitis or patellar tendinopathy or jumper's knee is really just a fancy phrase for when you overuse the patellar tendon, which is a tendon that connects behind your kneecap into your shin bone. It can be induced or caused by things like overuse, poor hitting mechanics, and improper footwear. A few things that can treat patellar tendinitis or jumper's knee include knee straps, icing, resting, lots of stretching, and even strengthening of your quadricep muscles. What's really important is to make sure that you do not diagnose yourself. If you're finding yourself landing on one knee and having really excruciating pain, it's super important that you see a doctor first and make sure that you're not giving a self diagnosis or deciding yourself that you have jumper's knee. If the pain persists, it's so important that you see a doctor, get an MRI, or even think about physical therapy, of course, under a doctor's supervision, because patellar tendinitis can lead to even more dangerous syndromes, putting a lot of stress on that tendon and particularly and possibly even a tear. All in all, jumper's knee is super common, super treatable, but it's really important that if you recognize you're landing on one knee on your landings, that you work on mechanics over anything.